This is Tracy Pearson recording for Ashley Walker on administration of enteral feeding.
Hi, I'm Ashley. I'm going to be your nurse today. Can I get your name and date of birth? Okay. We're just going to be doing some enteral tube feeding. Do you have any questions about that? Alright, I'm going to explain it as I go anyway. So I'm going to provide privacy. Need to wash my hands. I'm going to raise my patient's bed up. Alright. Now I want to listen to your bowel sounds. Alright. All of those sound good. I'm going to measure the abdomen. It's important that you mark on the top and bottom of the tape measure on each side so that we're all doing the same measurement and getting the proper measurement. I want to I can't remember if I said I need to get a baseline weight, but I do need to get a baseline weight and check my lab values. I'm looking for fluid volume deficit or excess. I am looking for electrolyte abnormalities, metabolic abnormalities such as hyperglycemia. And then I'm going to look at my physician's order. I'm looking at formula, rate, route, frequency, flush amount, and frequency order. And then I am going to bring my patient back down while I get my supplies around. I'm going to wash my hands. Okay, so when looking at the formula, I'm looking at the container, the formula itself, make sure it's all in good condition, that it's not expired, that it's room temperature, and I would want to shake it. And when I come back in, I'm going to get my patient's name and date of birth again. I got that. So I'm going to measure this out. We want 10 mLs of the flush. And we want 20 mLs of the ensure. Okay, so now I just need to check for my tube placement. So I'm going to wash my hands again. Raise the bed up. And I'd like to get my patient at a Fowler's position. After I wash my hands, I should put on gloves. Okay, and like I said, I just want to listen for the tube placement, so I'm going to draw up 10 to 30 mLs of air. I'm listening for like a swoosh sound. That was present. So now I'm checking for aspirate. You pull back until you feel resistance, and I'm getting about 40 mLs. And you're going to note the appearance of this, you know, the color, the amount. And then you're going to place it all back in except for 1 ml since it was less than 200. Okay. And now I want to check my pH. I have a strip right here. pH looks good. So I'm going to remove my syringe and we can begin. So the first thing you're going to do is the flush. The formula. And then next flush. Alright. It's important to keep this clamped off when you are not using it so there's not much air going into it. And I forgot to mention that when you're checking the aspiration, you need to do that before every feeding, and if it was a continuous feeding, then you'd want to do it every 4 to 6 hours. Okay, and now I'm going to clean my equipment, and we can let it dry. We can continue to use it for 24 hours, but then we would want to replace everything. And I'm going to wash my site with warm water. It can air dry, but if I had an order, I would place some dressing on this. I want to remind my patient I'm going to wash my hands. You have to stay in this position for at least 30 minutes, okay? Alright, so I washed my hands. I'm going to put on some new gloves. I'm going to perform oral hygiene. I'm going to remove my gloves and dispose of them. And I would wash my hands again. I am going to put my patient in the lowest position. They've already been instructed to stay in Fowler's. And I'm also going to want to do some evaluations. I'm going to want to check respirations, blood sugar, maybe watch my fluid intake and output, make sure that my patient's comfort level is always good. And I would make sure they had their call light, and I would see if they needed anything else before I left the room. I would take care of all my supplies, wash my hands, document the procedure.